Hello friends, Dr. David Katz, another COVID reality check. And I think it's probably only fair to say that this one is a reality check about reality checks. And what I mean is, I don't think it's possible to influence our pandemic policy in the United States, at least right now, with science or with sense. I think dogma is winning out over data, diatribe is winning out over reflection. And I don't think that will change until our political kettle simmers down. And I have always embraced the philosophy of Gertrude Stein, a difference to be a difference must make a difference. And so I've dedicated these videos to the cause of making a difference. But for the time being, I don't think I can. I don't think anyone can. It's a really strange situation, and I think the best way to characterize it is to invoke herd immunity. Herd immunity is the idea that when enough of us are immune to a pathogen, we're protecting not only ourselves, but everybody else. In other words, if I can't get an infection, I can't give it to you either. And so my immunity protects both me and you. The funny thing about herd immunity in the current context is it's always been a concept that has been embraced by the political left. The idea that we really need to consider one another's well-being routinely, think about ourselves in a communal context. I think it's a bridge too far to suggest that the concept of herd immunity is socialistic, but in some sense it really is. It's the idea that we need to look out for one another, protect one another. We truly are in this together. But right now, herd immunity is being rejected, being venomously rejected by the political left for the simple reason that it has been embraced by the administration currently in power. And I've concealed no part of my antipathy to the administration currently in power. I think the United States has been truly a masterclass in how not to manage a pandemic. I have argued many times we would have been massively better off if we'd had compassionate grown-ups in charge of the country. I don't think we did. But a broken clock is famously right twice a day. That's an analog clock. A digital clock is only right once a day, but once or twice a day, a broken clock is right. And frankly, I think the administration happens to be right about the importance of herd immunity, whether or not they're right about the best ways of getting there from here. The other thing that's important about herd immunity is that's what vaccines are for. The goal of a highly effective immunization or vaccination campaign is not to vaccinate absolutely everybody, but to vaccinate enough people so that everybody else is protected too. So in other words, all pandemics end with herd immunity. There is no other way, and the only question then becomes, what is the safest, most effective path to herd immunity? Is it native infection, because people can get whatever infection we're talking about, in this case SARS-CoV-2, and not be harmed by it? Or is it vaccination, because a highly effective, very safe vaccine is available and universally accessible and distributed? Or, and this is most common, some combination of the two. Some portion of the population gets the infection, gets over it. The remaining population that hasn't been exposed, when there finally is a vaccine, gets vaccinated, and the pandemic ends. And frankly, and I think all of my colleagues I respect would welcome the advent of a highly effective, safe vaccine to speed us on our way toward herd immunity. But between now and then, I think it's a mistake not to acknowledge that there are massive risk differentials associated with SARS-CoV-2, and that a very substantial portion of the population can get the native infection at vanishingly low risk of harm. Again, colleagues and I have written about this extensively and made the case that children are less likely to be harmed by SARS-CoV-2 in school than they are to be harmed by riding the bus to and from school. That doesn't mean the risk is zero. It just means there are greater risks that we all encounter in our daily routines every day. So the Great Barrington Declaration, which I signed, argues for focused protection. It has been excoriated by my usual tribe, if you will, because it advocates for herd immunity and essentially allowing the virus to circulate among low-risk groups. I think that excoriation is misplaced because it fails to consider that the Great Barrington Declaration leaves us to figure out, okay, how will we as a nation allow for viral circulation limited to low-risk groups and prevent the dissemination of the virus to higher risk groups? We have to do that. That calls for national leadership. You can't expect a very short call for the orientation of a policy to be the full policy. When I first advocated for total harm minimization by means of vertical interdiction, in other words, risk stratified interdiction or focused protection, I also made the case that the details of this would require a 1,200 or 1,500 page policy document, that we needed a multidisciplinary panel of experts convened by grown-ups running the country who would explore all of the subtle considerations in managing the most complex public health crisis in living memory, and then commission a veritable army of detailed policy writers. They could be MPH students from the nation's public health schools, they could be recent grads from those schools, they could be the Army Corps of Engineers, but essentially everyone in a roster of 300, 400 master's level educated people could be assigned a specific set of conditions. So what are the guidelines for a family where they're multi-generational and the grandparents are at high risk, the parents are at intermediate risk because of hypertension or type 2 diabetes, and the children are at low risk? How should that be managed? That's not simple, and it isn't easy. It's just possible. We needed to have done the work. We didn't do the work. The Great Barrington Declaration, or my call for total harm minimization by means of vertical interdiction, much the same thing, did not pretend to be a substitute for that 1,500-page policy document. Rather, we're pointing in the direction we think we need to go and inviting the work required to get us there safely. Anyway, my perspective is that right now we are so divided politically that the left cannot accept even the use of the term herd immunity, which again is bizarre. You can't write a textbook on epidemiology without using the term herd immunity. I know because I've written multiple editions of a textbook on epidemiology. So it's Public Health 101. It's a mainstay. And again, there's nothing about herd immunity that can or should be equated to sociopathy or genocide, but that's what we're hearing in the mainstream media now. And that really is simply testimony to our inability to listen to one another, our inability to look toward the middle, our inability to consider that there may be valid arguments coming from both political camps. We're so divided that all we really want to do is hurl projectiles at the other camp. And what's lost then is the required nuance to respond effectively to so subtle and complex a crisis as COVID-19. So we aren't responding effectively. But at this point, this is, I think, my 18th of these videos, I have more or less surrendered my prior naive hope that sense on the topic of pandemic response could make a difference. And again, a difference to be a difference must make a difference. And if I'm just talking and not making any difference, it's kind of a waste of time. Maybe not totally a waste of time, because my hope is some of you are finding comfort in the fact that we can meet one another here in the middle, that there really isn't a need to choose between the extreme poles of political opinion. In fact, we are trying to manage a pandemic in a sociopolitical blind spot, because the right response to SARS-CoV-2 is neither lock everything down nor liberate my state. It is in between, that place where no one is willing to go except maybe the few of us. But the simple fact is, our political kettle is at the boil. And until it simmers down, I don't think further dialogue on this topic is likely to make much difference. So I don't know that I'll record another of these until at least after the election in the United States. I'm hoping that in the aftermath of that, it will be a new day and there'll be a renewed capacity for civil discourse and listening to one another and reflecting before rejecting an opinion we don't happen already to own. I certainly hope that we will be able once again to acknowledge that all pandemics end with herd immunity, whether achieved by native infection, immunization, or combination of the two, and that consequently the notion that herd immunity implies genocidal inclinations is completely absurd. I hope that day will dawn soon, and if so, with even the earliest indications that there's an opportunity for sense and science to prevail, I will jump back into the fray. But I think for now, all we can do is wait. I think we are driven by the prevailing currents of our culture. I think we are driven by the inertia of prevailing inclinations. And we just have to be patient and wait. In the meantime, I don't think the sky is falling. We continue to see rising case counts, but thus far we're not seeing rising casualty counts. I remain hopeful based on a lot of published evidence that we're far closer to herd immunity than most seem willing to acknowledge. And while we're at it, I remain hopeful that we will soon get a highly effective vaccine that will speed us on our way. So as our friends across the pond say, keep calm, carry on, and I'll be back with you on the flip side.